Hi, I'm Pam Dixon of the World Privacy Forum. I'm in Mysore, India, and I'm at a hospital here. I've been in India researching privacy, and it's been rather empirical research, but thanks to a little motorcycle spill, I was able to actually do some personal research into the differences between the healthcare system here in India and in the US in terms of privacy. So I came here and I registered and got a nice little booklet. The records here are digital. And the first thing they asked me for, after they asked for just a little bit of cash, was my mobile number. And I gave it to them, and they immediately sent me a welcome text. And so far, there have been no junk mails or anything like that. It's just a welcome text, and it's a way of communicating with patients, because most patients in India do have a mobile phone, but don't necessarily have email. So it's a different way of doing business here. So the problem was a potential broken right toe, which actually an x-ray showed was broken. What was really intriguing about this experience is that I walked out with my x-rays. I also had an MRI done, and it was done in a digital lab, and I walked out with several images of my MRI. It's really intriguing because in the US, it's actually, you have to go through a request process to get these records usually, and doctors are not frequently just going to hand you your x-ray or hand you a printout of your digital MRI, whereas here they do. And it's a nice custom, and it's a long-standing custom in India for people to manage their own healthcare files themselves, and it continues to this day. It's a very nice feature of Indian healthcare. This certainly, in the US, it's one of the problems that medical identity theft victims have, is they frequently don't have these kind of records right when they walk out of a treatment facility. It allows you to really prove what treatments you've had and have that proof right in hand. It's a nice thing. The other thing I noticed in terms of my experience here is I wasn't necessarily signing a whole bunch of medical privacy forms here. In fact, I really didn't see any. And that's a contrast to the US. The medical records flow freely, and as you can see, one of the results is that I got a copy of my MRI, which was very interesting. I went to the pharmacy. I was able to show my prescription and get medication right away. And there was no, electronic version of this going off to some e-prescription center or any further, healthcare provider. So still, even though these records are digital, there's a sense of these records really staying in one place. They're not being exchanged. There's not a lot of movement between institutions at this point. I would imagine that's coming very soon. But until then, I think that India is really working toward a much more digital system. And at this point in time, there's still a little bit of privacy through obscurity here. It's a very interesting contrast with the US, where that really is not existing so much anymore. Thanks.